Good morning. Thank you for being here on this gorgeous fall morning. I love it when it's chilly like this. Can you believe it's almost election day? Great news too about our website. We've gone viral. We have lots and lots of people looking at our candidate information and forums. Just as a reminder, the League is a grassroots nonprofit organization grounded in our nonpartisan policy, meaning we neither support nor oppose any candidate or political party at any level of government. This protects our 501c3 status. Let us be leaders in civility and in the political arena. Our mission, this is even better. Our mission is to defend democracy and to empower voters. We continue our efforts to engage and educate voters on upcoming elections and public policy through programs like today's. We aren't partisan, however, we are political. Our league has been actively involved in federal, state, and local government and public policy for more than 71 years, as evidenced by our long-standing position statements. Harry Bognich, one of our presidential leadership team members, has a few announcements for us. Harry, come on up.
Well, I'm glad to see we have a lively crowd already. All right. Okay. Well, Ruth Kane, Mary Estrada, and myself, Harry Bognich, are serving as your presidential leadership team. And we have 8 important announcements. So, buckle up those seatbelts, and we're blasting off, and I'm warning you, this could be a challenging ride at times. 1, we do not have a monthly member meeting in December, but we do have something special and fun. Our holiday social party is Wednesday, December 4th at the Meadowbrook Park Clubhouse, 91st and Knoll Streets in Prairie Village. Now, so far, 22 members have registered. That's good, but we got a lot more members than that. All right, please register. It's important so that we can prepare for this get-together. And we really need a count because we must order food, drinks, etc. The deadline for registration, don't miss the deadline, is November 29th. Remember, you can bring a friend. And the online registration will ask you for a people count. In addition, the membership team is asking members to volunteer to bring sweet or savory treats or monetary donations to help with the food costs. And you can sign up on our website. If you are in need or you know someone who is in need of transportation to and from our holiday social, because maybe you don't like to drive at night or whatever else, please contact membership at lwvjoco.org and provide your name, phone number, and home address. And Nancy Allen back there is ready to write these down. Okay. Or if you know somebody, again, contact membership. 2, our league's in-person book club met on Tuesday, October 29th, and the next in-person book club will reconvene in January. They want to go to the party. Number 3, our membership team has a new initiative and are looking for members who are open to making up to 3 phone calls to members each month so we can really hear what members have on their minds. Enjoy chatting on the phone with another member. And then all you do is complete a short survey of your chat. Stop by the membership table to learn more, or email membership@lwvjoco.org to volunteer, or ask any questions you might have about that. That's a great new initiative. 4, how many of you read the outstanding and informative Observer Corps reports that we are so fortunate to be able to obtain each month in the Voter? I'm not going to ask for hands, but if you don't read those amazing articles and learn firsthand what is going on in Johnson County at the county commissioner meetings, the mental health center meetings, the library board meetings, the school board meetings, and so on, then you are really losing out on being informed about what's going on in Johnson County and impacting your lives every day and every week. Now, on the other hand, we do need more members to get involved with the Observer Corps. If only a few members are willing to observe, then we get less and less information. For example, we get a great observer report on the Prairie Village City Council. But there are many other city councils where we have no observer. We are missing observers for other important meetings going on in the county also. Now, Ruth Kane, Mary Estrada, and I on the presidential leadership team give a huge thank you to all the observers that we do have and who do so much to serve our league members. In the Voter, it says to email observercorps@lwvjoco.org if you wish to volunteer or find out what meetings you could observe or get answers to your questions. Maybe you have questions about the Observer Corps. 5, Ruth, Mary, and I wish to give special congratulations to the voter information and voter registration teams for their hard work and dedication to informing and helping people in Johnson and Wyandotte counties to not just vote, but to be informed voters who help. All other members and teams who helped in this effort for this monumental November 5th election, our thanks to you as well. In fact, we the PLT were notified last week that our online candidate information webpage was getting more hits than usual. Our YouTube page is also getting lots of views. Plus, we learned that candidates are telling voters to go to our candidate and judge page because they think it's good and they want voters to be informed about them. All right, here comes the tough one. Number 6, Ann Sanders is the chair of the nominating committee. And they're facing a huge challenge and need your willingness to help. The nominating committee is tasked with finding all the candidates to be elected to multiple offices at our March 1st annual meeting, which is now only 4 months away. Our league needs a president, a vice president, a secretary, a voter information team chair, a voter registration team chair, and the list goes on. In total, we need 14 members who are going to step up and volunteer to help when the nominating committee begins calling members to ask you to become a candidate for one of these elected positions. Now, in the cases where I said that a chair is needed, we have current chairs who are willing to help and train somebody to be the chair. So you're not going to be alone by yourself. Also, be aware that the chair is just supposed to be the one who helps to coordinate things and maybe be a spokesperson for the team. The chair is not the big boss. Okay? The chair is not the one who needs to be getting everything done. All the members of the team are the ones who get things done by working together. If we want our league to be active and vibrant, then all of us need to be active and willing to volunteer to serve. I'm going to have Ann Sanders stand up for just a second so you know who she is. And she says she's going to provide her email and that.
Good morning. I'm going to give a quiz. It's an easy one. I expect everyone will. How many? How many this room leave that are those persons all time? All right. We have 296 members. So, I have served in a number of positions. What I have found is no one is the big boss, but the energy help convene people their so I am chair of the nomination and big job, not just big job to find the leader who is strong. So after the meeting, I have some cards, and I have some cards. All I want you to do is the email address, my email address, and that you'll have to talk to someone to inform them and to try to get them to run for office. Because I think you'll find that you know other great leaders around the state. So I'll be standing and I'll be giving you cards. Is my email address. I go to the league website and look on the directory. That's another step. But if you had something, you didn't have to look it up. I'm trying to make it as easy as possible. 296. On at one time, definitely we say leave the women voters, we go into something in there, but I know that we have the talents right now.
Thank you, Ann. Number 7, we're getting close now. Look in this month's The Voter and see all the special things going on. An amazing event is going to burst forth in Topeka on Thursday, November 14th. The Topeka school kids sent out an invitation to Ruby Bridges to come to their 2nd annual Ruby Bridges Walk to School Day. And Ruby Bridges said yes. She is coming in person to speak to over 1,000 Kansas students. The voter provides the website for more details, and maybe, we hope, the web will eventually announce where her speech can be found for those of us who cannot go to Topeka. Next, if you are looking to save on your 2024 income taxes, see the voter about a donation to the Suffragist Memorial Mural Fund. Sponsor the League of Women's Voters Mural and lower your income taxes with a charitable donation. Finally, a big thank you to Diana Carney, the chair of the communications team, who puts together The Voter each month, and other newsletters like the E-Blast. To Ann Norbury, who maintains our website and all its information. To Karen Leacox, who maintains our social media presence. And to everyone in communications who help keep us and the public informed. And now, after I've kept you on the very edge of your seats with all these announcements, let's get to what you really came to this program for. An exciting program. Here to introduce our panelists, our vice presidents, Karen Sorensen and Patty Deichman.
We'll let the speakers get situated. Good morning, I'm Patty Deichman, and I have the pleasure of introducing our presenters. During the presentation, there are note cards on your seat. As is usual, feel free to write a question, hold it up in the air. We will get it up here to the panel to be able to answer questions you may have as the presentation is going on. We are so fortunate. We have Sherman Smith, April Holman, Recorder Ortiz. Let me give you a little bio of these people so you know who they are. Sherman Smith is the current editor-in-chief of the Kansas Reflector. It's a great newsletter. You need to sign up for it. That's my little plug. His bio I have just taken strictly from the Reflector page. Sherman Smith is the editor-in-chief of the Kansas Reflector. He writes about things that powerful people don't want you to know. A two-time Kansas Press Association Journalist of the Year, his award-winning reporting includes stories about education, technology, foster care, voting, COVID-19, sex abuse, and access to reproductive health care. Before founding the Kansas Reflector in 2020, he spent 16 years at the Topeka Capital Journal. He graduated from Emporia State University in 2004, back when the school still valued English and journalism. He was raised in the country at the end of a dead-end road in Lyon County. April Holman is the executive director of Alliance for a Healthy Kansas. The Alliance is a nonprofit initiative working to improve the health, well-being, and financial security of Kansans by increasing access to affordable health care, promoting health justice and dignity for all consumers, and reducing medical debt for Kansas consumers. April has spent over 2 decades working to improve public policy in Kansas. This includes various roles in the areas of tax and economic development, early childhood policy, adult care policy, and access to affordable health care. April is a licensed attorney and holds degrees from Washburn University School of Law and Bethany College in Lynchburg, Kansas. Ricardo Ortiz is the program manager for the Kansas Assistance Network, which is part of the Community Health Council of Wyandotte County. Ricardo is a licensed health insurance broker and K-A-N, helps people sign up for insurance through Medicaid, Marketplace, and Medicare. Ricardo has worked in health insurance since 2018, first as a certified application counselor, where he helped people enroll in the Marketplace before becoming a broker in 2020. Ricardo obtained his Bachelor of Arts degree in political science from the University of Kansas, and he added this, rock chalk. As you can tell, we have a very qualified panel to discuss our topic of expanding Medicaid in Kansas. It's up to you.
We're grateful for the opportunity to be here and have this conversation. I'm thrilled to share the stage with Ricardo and with April. And Don't forget to send in your questions as we have this conversation so we can make that part of what we're doing. I just want to start with the acknowledgement. We're all, represent nonpartisan organizations, but, as a journalist, our job is to speak truth to power. And a lot of what we hear in Medicaid expansion, there is some philosophical differences, but so much of what we hear is just false information, plain lies from political leaders. And so I just want to acknowledge that will shape the conversation that we have today. We'll start with an overview of Medicaid expansion and just Medicaid in general. Medicaid is a program, federal program administered by states. It serves about 80 million low-income Americans nationwide. But there are millions more who fall into what's known as the coverage gap. And that means you make too much money to qualify for Medicaid, but not enough to afford to buy insurance on your own. Your employer doesn't provide it, and so you're stuck in that gap. Let's talk about what Medicaid is, what CanCare is, and why this is different from Medicare. Ricardo, you want to start?
Yeah, I'll start. So as you mentioned, Medicaid is for those who are of limited income and resources. So it has different requirements for eligibility depending on if you fall for families and children and elderly and disability. The biggest difference between Medicaid and Medicare, which a lot of people get confused, especially in Kansas, because each state has a different name for their Medicaid program. In Kansas, it's CanCare, so it's easy to confuse with Medicare. But Medicare is typically for those who are 65 and older. There are some exceptions to that, so those who have received Social Security disability income for 25 months become eligible for Medicare even if they haven't reached the age of 65. Those who have Lou Gehrig's disease or end-stage renal disease will also qualify for Medicare before they reach 65. But that's typically the people who get Medicare. Medicaid can also qualify for those who are elderly or people with disabilities. The other difference, Medicaid, typically you don't have to pay much out of pocket, if anything. Sometimes there's a copay or a premium for those whose children are in the Medicaid program, but their income is considered a little higher, so that they can still get Medicaid, but it's through something called the CHIP program, which is the Children's Health Insurance Plan. Medicare, pretty much a lot of it is out of pocket, so there is a premium. It changes every year. Most people don't have to pay for their Part A, which is the hospital, if they've worked 40 quarters or 10 years, and they've paid into the Medicare, if they pay into Medicare. Part B, everyone will usually pay. That varies. This year it's $174.70. It's going to go up next year. Medicaid can help pay for that, but typically for most people, at the minimum would pay the $174.70. And then when you do go to the doctor, usually there are co-pays and co-insurances that you have to pay for those.
Just to clarify one more time, Medicaid and CanCare are the same thing. It's just CanCare is what we call the state program that administers. So we might use those terms interchangeably. Did you want to expand on any of that, April?
So one of the things that I wanted to just point out, because I didn't realize this before I started working in this area. In Kansas, our Medicaid program, CanCare, is pretty streamlined. So we don't provide a lot of the optional coverages that they might provide in other states. And in fact, for adults, the basic rule is that adults in Kansas aged 19 through 64 do not qualify for Medicaid. You need to meet a certain exception, and there are only a handful of them, in order to even receive Medicaid as an adult in Kansas. One of the more popular ways that people do qualify is if they have a disability that is recognized by the federal government, by the Social Security Administration. If any of you have that disability determination or know oh gosh, I won't do that again, or know somebody who does, it is a very high bar and a very difficult process that often takes people multiple attempts to be able to qualify and get that determination. And there are also reasons why people may not want to apply for that because it limits the amount of hours that you are able to work and what have you. So even somebody who has a disability that we might recognize as a limitation in being able to work may not have that Social Security Administration determination. So that is one way that you can qualify for Medicaid health coverage. Another way is if you have a child under the age of 19 in your home and you only make 38% of the federal poverty level or less. So if you think about that, you think of someone who is fully living in poverty. Now you scale that back by almost 2/3, and that is how little money people can earn in a year and still qualify for Medicaid coverage as an adult with dependent children.
So we're talking about the federal poverty level. For a family of 4, that would be about 11,500 is the cutoff in Kansas.
Per year.
Yeah. Once you make 12,000, you don't qualify. You're too rich.
So a lot of times we'll hear people assume that if you are in need and you're low income and you have a physical or mental health need, you'll be able to qualify for assistance from the state through Medicaid. That is not true in Kansas. And I think it's really important when we start talking about the coverage gap that's created because we haven't expanded eligibility for Medicaid in Kansas. We are talking about a lot of people across the state who are really struggling to get by and really struggling because they don't have their physical and behavioral health needs met.
Ricardo, pregnant women are also part of this group, right?
Yes, correct. Pregnant women is probably like the second least stringent group that can get Medicaid, but it's still, I believe, 149% of the federal poverty level.
172.
172, sorry, yes. 172% of the federal poverty, which is not very high either.
And April, I think you have an estimate of how many people are currently enrolled in CanCare?
So as of August of this year, about 427,000 Kansans qualified for Medicaid, and that is in all of the different exceptions that we talked about, and also that includes all of the children who are covered through the Children's Health Insurance Program.
So the Kansas Health Institute has looked at Medicaid expansion estimates for a long time now. Their latest estimate earlier this year was that about 152,000 Kansans would gain coverage through CanCare if Medicaid were expanded. And when we say Medicaid would be expanded, we're talking about going from 38% of the federal poverty level to 138%. So that family of 4, the new income threshold would be about 41,500 if Medicaid were expanded. Of that 152,000 who would gain access through CanCare, about 45,000 of those would be children under the estimates from KHI. The question is, who benefits from expanding Medicaid? Who are those 152,000? I have some thoughts on this from reporting that I have done, but Ricardo, do you want to start us?
Yes, I mean, the biggest group would be, or one of the biggest groups would be working parents. So like I said, we help people with Medicaid. Typically, the only time parents will qualify for Medicaid currently is if both parents are not working and there is children in the household. If someone's working, they will not get Medicaid. And so the parents who are working are able to not have income in the household will actually be able to get insurance, and at that point, if they don't qualify for Medicaid because their income is too high, then they have the choice of Marketplace as well, so that coverage gap does end for them.
So kind of going back to the same report that the Kansas Health Institute did, and expanding on what Ricardo said about working people, that report found that 69%, almost 70% of the people who are in the Medicaid expansion population are working. Many of them are working multiple jobs. And so sometimes we'll hear opponents to expansion talk about, well, people just need to get a job and then they'll have insurance. That is not the case these days. Maybe it was 30 years ago when I first started in the workforce that, you know, if you had a job, almost always you got some sort of insurance with it. That just isn't the case in Kansas and across the country now. And sometimes for low-wage workers, they just can't afford the employee contribution that needs to be made. And so I think it's really important to know that people who would benefit, many of them are low-wage workers. So people who are on the front lines, working in restaurants, working in education, as you know, people who help in the lunchroom and who might be bus drivers who are working part-time throughout the day but are absolutely vital in those roles to the functioning of our communities. And so I think that's important. There are a lot of parents who have a young child at home who need care, and they are in that expansion population. There are some students in the population, and there are people who they're either ill or they have something that we might think of as a disability, but they just have not gotten that determination from the Social Security Administration for whatever reason. So I think that it's important for us to understand these are our neighbors and relatives and friends, and maybe even some of us who are in this situation, and just because we haven't expanded eligibility for Medicaid in Kansas, are falling through the cracks.
I tried to address this question in a story that I wrote late last year as part of a series we did on Medicaid expansion. Because so many of the political leaders use this line about not wanting to serve able-bodied adults who choose not to work. That's one of the talking points, and to be clear, when they say that, they know that they are lying. They know that that is not who this is. You know, what we found was, as April says, primarily who we're talking about here are small business owners and their employees, students, cancer patients, and people who need mental health services. And so I tried to find people across the state that I could talk to who fall into this coverage gap, who would benefit from Medicaid expansion, about their personal lives and why they're in this situation. And I'll just pull one of these examples out of my story. I printed this off this morning. The story was 17 pages long, a little longer than I remembered. But if you're interested and have a lot of time, there are several other examples here. But I talked to Taylor Naden, who lives in Lindsborg. She's somebody who ran a coffee shop. She makes jewelry and other things on the side, other artwork on the side that she has tried to produce. She talked about the struggle of working 40 to 60 hours a week in this small business in a small town. The most that she ever made in take-home pay in a year was between $15,000 and $20,000. She is also suffering from a mental illness. And so she talked about being in these situations sometimes where she could not afford her medication, and so she would just not get her medicine, and then the mental illness would take over and she wouldn't be able to work. So actually the lack of Medicaid expansion is preventing her and many others from being in the workforce. She has had a 2-year-old at the time that I talked to her a year ago. And I asked her about this talking point where people say that the people like her who would benefit are just able-bodied adults who choose not to work. And she said, quoting now, "It's frustrating because I'm obviously an able-bodied adult and I do work, but I have my unique challenges that I haven't been able to overcome. And it's frustrating for somebody to make it sound like I'm not trying hard enough." I know the Alliance has tried to put personal stories online. Are there any stories that resonate with you that come to mind?
Yeah, so we actually have been talking to a woman who's from southeast Kansas, and she has, for most of her career, been someone who provides direct service to, like a direct service attendant to people in nursing homes and home health care, and that's a very physically demanding job. She is actually very similar in age to me. She's getting older, and that is taking a toll on her body, and she has back problems that are keeping her from being able to work the hours that she needs to, and she does not have any coverage. She falls in the healthcare coverage gap and is one of those people who are really, she wants to work. She feels a deep connection to the people who she has cared for, but she's just physically not able to do that kind of heavy lifting and difficult work that she's done before. And she finds herself in a position where she's kind of in a catch-22. She can't get well enough to work, and she can't work because she's not well enough.
We have a question from the audience about how many states have expanded Medicaid. I should have mentioned it. So, and also a question about whether this passed at the national level. The Affordable Care Act passed in 2010, I believe, initially required states to expand, and then courts took the mandatory part out of that. So states have the option of expanding Medicaid. I should say that right now, Kansas is paying, was it 40% of the cost of people on Medicaid? Mm-hmm. If expanded, the carrot there is that states then only pay states would only pay 10%. So if you expand, the federal government picks up 90% of the cost of these services. 40 states have expanded. Kansas is one of the 10 holdouts. There are a couple more questions that we'll get to in a second as we go through. But I want to highlight some of the things that the Alliance has pointed out as advantages of expanding Medicaid. This reduces the health care costs for all, protects Kansans from medical debt, fixes eligibility limits, preserves and strengthens rural health care, makes Kansas more economically competitive, and addresses workforce issues. Do you want to expand on that?
Yeah, it occurs to me that when you asked the question earlier, who benefits from Medicaid expansion, I went directly to the consumers, the individual who gets access because of expansion. But there's also a large group that I didn't talk about that benefits, and those are the providers. So hospitals and clinics and even physicians now are providing care to people who are in the coverage gap and don't have insurance, and then they're not able to afford to pay the bill. And so those high levels of uncompensated care make it very difficult for hospitals to keep afloat, particularly when we look in the rural areas where we have smaller hospitals, they have tighter margins, and they struggle when they have big parts of their population that can't afford to pay their bills. And so I think that really kind of goes back to this idea that it would help everyone across the state, but it would particularly help those in rural areas. And I also want to point out that one of the things that we are seeing, because all of our neighboring states have now moved forward with this, we're seeing in border areas like the Kansas City metro area in southeast Kansas, there's a center of population in Pittsburgh, and then on the other side in Joplin, we see that with the Oklahoma border in several places, like in Coffeyville, there's a Coffeyville, Kansas, and South Coffeyville, I think, Oklahoma. And we see a struggle with our Kansas hospitals and clinics trying to keep personnel on our side of the border because they can pay more money. They don't have the same level of uncompensated care on the other side of the border. And it's becoming more and more of an issue the more years they've had expansion in place. So that happened in 2020 in both Oklahoma and Missouri. And in Nebraska, it was even before that, I believe in 2018. And Colorado's had it since the first year they could. So we see more impacts than just the ones that are directly related to the people.
Just as an example, we were talking about this with the sheriff in Pittsburgh last year, And he talked about how they had a woman who was suffering a mental breakdown, was suicidal. She had not committed a crime. They could try to put her in jail overnight for her safety, but there was no place they could take her in Kansas. And so he instructs his deputy to drive her across the state line and drop her off in the town in Missouri so that she could get the care that she needed. Ricardo, what would the advantage be in Wyandotte County?
I mean, same as everywhere else. I mean, people need healthcare regardless of whether or not they have insurance. And we've had struggles with our federally qualified health centers or safety net clinics with keeping up with the demand of people. There's unfortunately, like in a lot of places, a large population of people who don't have insurance, so they will basically, my leg hurts, I'm not gonna deal with it. Ooh, my leg actually really hurts, I'm not gonna deal with it. Ooh, I don't feel at all good, so I have to go to the hospital, and because they're not taking care of that from the beginning, not only are their health outcomes worse, but then also they end up with a bigger bill than if they were able to go somewhere to take care of it from the beginning and make sure that the little blister or whatever it was from the beginning doesn't become something that needs to be amputated, for example. And unfortunately, people do live that as a reality since they do not qualify for insurance because they need to work to get insurance, but then they don't feel well enough to work, and then they need, it's just a vicious cycle, unfortunately.
I'm going to go off script and put them on the spot here with one of your questions. For the states that have adopted Medicaid expansion, is there evidence of improved health care, a decrease in rural hospital closures, or an impact on the state budget?
Yes, to all of those things.
Yes.
I often say that there are very few benefits from being one of the last states to expand, but one of those benefits is that we can learn from the experience of the states that have gone before us. And there is absolutely data out there that shows all of those things. We see often pushback about this idea that it helps keep rural hospitals open if a state has Medicaid expansion. And there's been some really interesting research that came out of the University of Colorado that showed that even though hospitals are going under in states that have expanded, it's happening at a much higher rate in states that haven't expanded. So for instance, a state like Kansas that has refused to expand eligibility for Medicaid, rural hospital is 6 times more likely to close than in a state where they have expanded Medicaid. So we don't want to overemphasize the role of expansion. It is a very important tool that helps that we don't have here. There are many problems with our healthcare delivery system that need to be addressed. I would love to be able to work on advocacy from some of those other perspectives because this one seems to be a very simple solution that 40 other states have already taken advantage of.
Yeah, Kansas has a higher uninsured rate than the national average, and the expansion states, that's also true in the other holdouts that have not expanded. And there have been a number of academic studies now that look at the health outcomes in those states, the expansion versus non-expansion. And so you can actually calculate how many Kansans are dying each year because we have not expanded Medicaid. We can talk now about the opposition to Medicaid expansion. Because I think at the heart of this is a sincere philosophical point that is not politically advantageous. And so what we actually hear are a lot of explanations that move around all the time, they move the goalposts, and are not true. But the philosophical idea is that providing insurance should not be a government function. There's a philosophy about limited government. There's a tax on big businesses effectively that pays for the Affordable Care Act. It is budget neutral, it's not driving the deficit, but big businesses don't like to pay those high of taxes, and so they have this opposition. And so this manifests in lobbying efforts through groups like the FGA, that's the Foundation for Government Accountability. Their lobbying operation is Opportunity Solutions Project. Those are two very big forces in our state house. And they influence the leadership, which is why we see leadership opposed to Medicaid expansion, even when a lot of rank and file Republicans do support Medicaid expansion. So that's the real core of this, but going out and saying government shouldn't take care of sick people isn't as convenient as saying these are able-bodied adults who are just too lazy to work. And so we hear that. I think historically there were concerns about whether the federal government would pull the rug out from under states, right? Well, what happens if they stop providing the 90% match rate, or if courts strike down the Affordable Care Act? I think that was kind of diffused partly because the Affordable Care Act has become so popular over time, but also just the reality that if they did, you could just pass a law in Kansas that undoes it. The second thing was early on there were some cost estimates that did not play out very accurately. States thought it would cost one thing, and so many more people signed up than they anticipated. The people at KHI have talked about how the Kansas Health Institute, about how much easier it is to calibrate your estimates now that we've seen 40 other states expand. We know more precisely how many people are going to sign up. So that's not as much of a concern. There are a lot of concerns that get expressed in opposition to Medicaid about how much this is going to cost. So the latest estimate from the Kansas Health Institute looked at the plan that was introduced by the governor last year in January, so early this year, this past session. They found that with some strings attached to that plan, it would be budget neutral in Kansas over the course of 8 years. I think the annual cost to the bottom line after that might be in the $60 to $70 million a year range. But there's a question about how much that would be offset through economic impacts, which are very difficult to prove or to calculate. But we know that expanding Medicaid would bring in about $700 million in federal funding every year. And so if you inject $700 million into the Kansas economy, what does that do for tax and revenue collections? And how much of that would offset the cost of the state? So it's a little unresolved, but when we hear a lot of times from opposition saying this is going to be too costly, it'll bankrupt the state, the evidence suggests otherwise. April, have you heard other oppositions to Medicaid?
So again, I don't think that this is a true opposition statement because it's been debunked like multiple times, and this one keeps coming back. But because Medicaid is a big program, it provides health care coverage, and then there are also some special, another part of the Medicaid program provides direct care services through the Home and Community-Based Services program. It's a totally different funding stream. One does not impact the other, but we'll often hear opponents say that this would harm people who have disabilities who might receive those services through the Home and Community-Based Service program. All of the organizations that represent people who have disabilities and receive those services support expansion, in part because those direct service providers, the people who are doing the work, are often in the coverage gap and need to have expansion in order to be healthier and more able to be on the job every day. But that's one example that we hear often that does not ring true. We also hear, and this one kind of offends me, but we'll hear people say that we can't afford to do this because it will harm our children and grandchildren by increasing the federal debt. And the reason that offends me a little bit is that it assumes that it's okay for the 40 states that are already doing this. Big states like California and New York and Massachusetts and Indiana and Michigan It's okay for them and to have this coverage, but we're going to draw the line right here in Kansas and say that we can't allow people to get the coverage and care that they need in order to help the future generations. I think that is really, it's kind of a joke. And I think that it's sad that we would even try and make that argument, because we know this is not going away. 40 states already have it. That means 80 senators in the US Senate have people at home with a vested interest in keeping this in place. The likelihood of the federal government undoing expansion at this point is slim to none. And so I think that we need to just get on board.
One of the most recent, I think, talking points or opposition to Medicaid expansion now deals with reimbursement rates for services. They can point to the current reimbursement rates for services under CanCare and say, these are not the true cost, and so the hospitals that are providing these services are actually taking a loss when they take on CanCare patients. Setting aside the part that the legislature determines those reimbursement rates and could fix that, there's also a gap between, if you have insurance through your employer, there's a gap between what that insurance is paying and what the actual cost is to the hospital as well. And it also ignores the fact that there are a lot of people who show up in the emergency room, hospitals have to treat, and they don't have the money to pay for those services. They're uninsured, and it's just uncompensated care. There's a question here about the intellectual disability and developmental disability waivers, which we've done some reporting on. I think that touches on the disability issue you were talking about. Do you want to expand on that?
Yeah, so that's exactly the issue that I was just talking about. There really is no connection between the funding for one and the other, but it is, I think, a huge federal program called Medicaid, and both of those things fit under that umbrella. So I think that in this past year, there were increases that were made in funding for those home and community-based services for people who have intellectual and developmental or physical disabilities. And I think that's really important. I am an absolute advocate for increased funding to bring those waiting lists down. And I think, like Sherman said, the legislature has had the power to do that all along, and I think that that's wonderful that they did it. I do not see any sort of either-or scenario where you either increase eligibility for Medicaid or you bring down the waiting list. So I don't know if that answered, I don't know whose question it was, but hopefully that answered your question.
What is the process for getting Medicaid expansion in Kansas?
Well, so in Missouri and Oklahoma and Nebraska and many other states, they were able to pass expansion with a ballot initiative because their constitution allows for items to be taken directly to a vote of the people. The Kansas Constitution is not that way. We cannot do that. In order for us to do a constitutional amendment on expansion, there would actually be a higher bar to cross. We would need more votes in the legislature than just to get a simple law passed. So there also have been states like Colorado that the governor just said, by administrative act, we're going to expand eligibility for Medicaid. That's allowed too. But not in Kansas, because our legislature back during the Brownback era, they passed, he also vetoed expansion the one time that it passed. But the legislature passed a bill, so we have a law on the books saying the governor is not allowed to enact expansion administratively. So we have to go through the legislature and a law change.
Do you want to add anything, Ricardo?
No, she said
Okay.
it pretty
Sorry,
well.
yeah.
I think this goes with a couple of questions we have here about the elections and how this is playing out in the state elections. So I'll back up a little to talk about the governor's statewide tour, I guess, last fall to promote Medicaid expansion. She made it a priority during the legislative session and also made it clear that she was forming a PAC, the Middle of the Road Political Action Committee, and that if the legislature did not expand Medicaid, she would use that PAC's influence to apply pressure during the campaign, during the election season. Obviously, they did not pass Medicaid expansion. The Middle of the Road PAC has spent about $500,000 since August on some competitive races. April, do you have a perspective on whether the governor's efforts have actually made a difference in these campaigns?
So just as a caveat, we are also a 501c3 nonprofit, which means that because of our tax status, we can't become involved in electoral campaigns, and we can't endorse candidates and what have you. So we've kept a little bit of an arm's length distance from the campaigns that are going on. What I can say as an observer is that some very interesting things have happened with expansion and the support for expansion. So, for instance, the Speaker of our House, who is a gentleman named Dan Hawkins, he's from Wichita, he speaks often. I've heard even he has some commercials that are running down in Wichita where he talks about improving Medicaid and how much of a priority that is to him. And we have seen in past years where during elections there were a lot of flyers that talked about, this candidate wants to increase your taxes because they support Medicaid expansion. We have not seen those this year. I think it's pretty clear to everyone involved that Medicaid expansion is popular among voters, and nobody wants to admit that they oppose it, and they've kept it from passing. So then, we hear weird things like, oh, I thought Kansas already passed Medicaid expansion, because people have heard these presentations or seen the ads on TV. So I think that's very interesting, and I hope that means that people will be listening to their constituents a little bit more closely when we get into the next legislative session.
One of the advantages for leadership of never allowing a vote on Medicaid expansion is during the election season, candidates can go out and say, I've never voted against this, and of course I would support it if it ever came up. And so it insulates them a little. And of course, there are a lot of things that are on voters' minds when they go to the ballot box. We saw with, I think, the constitutional amendment votes 2 years ago in August that you have a singular yes or no issue, people can make their voices very clear. But when you are choosing a candidate, there are a whole lot of things that factor into that decision. And so, I don't have a good sense of whether people are casting votes based on their support for Medicaid expansion. And so in terms of the process of how this could ever get through the legislature, what we've seen are attempts to hijack legislation on the floor. A bill will come up for a vote on the House or Senate floor. Somebody will propose an amendment that replaces the entirety of that bill with Medicaid expansion. And then inevitably the rules chair steps in and says, you can't do it because these two bills are not similar enough. And of course, if you have the votes, the rules are whatever you want them to be. But that would be the possibility. If ever a health care related bill made its way to the floor, somebody ran an amendment to replace it with Medicaid expansion. Democrats and moderate Republicans successfully did this in the House several years ago, but it never came up in the Senate. There was also a plan in the Senate where the Senate Majority Leader reached a deal with the governor. More than half of the senators sponsored that bill, but this was in 2020, and the Catholic Church blocked it from moving forward because they wanted the abortion amendment. And so there was
also COVID. So
yeah,
they
we also had
ended early.
COVID, so it was a short session. So those are kind of the challenges that you run into with the legislative process. You basically have to throw a Hail Mary to get something past leadership. And you need enough legislators who are willing to risk their political careers on this to know you'll never be a committee chair. They're going to come after you in the primary next time, the GOP primary. That's the kind of the challenge of why we don't have Medicaid expansion.
Can I just comment on something that you mentioned? So you said that we don't really know that people are taking thoughts about Medicaid expansion to the polls. And actually, the Kansas Speaks poll came out this past week. And one of the things that it said was a large percentage, I think over 70% of people.
72.4%.
yes. So said that they care about Medicaid expansion, and they're thinking about it when they think of the candidates who they are voting for. I can't remember how the poll was
Well,
phrased.
72.4%
Support
support
it.
Medicaid expansion. But this is similar to, reproductive health care, marijuana. Same day the poll came out that showed 75% of Kansans support medical marijuana and over 60% support recreational marijuana. The marijuana committee in the legislature decided not to take this up next year. So, we do have a number of these issues where 2/3 to 3/4 of Kansans believe one thing and the legislature does something else. How do you explain the disconnect between what people want and who they put into the legislature?
So that is a frustrating thing. I've had this conversation. So there was a former legislator who was down from South Central Kansas, and we talked about this exact issue, and she said people don't want to run for office, and that's what it is. There's nobody who wants to run against them and go to Topeka for 4 or 5 months out of the year, and we just can't get people to do it. So I think that's part of it. I think part of it is that there are those legislators who keep their powder dry and don't really talk about what their thoughts are on expansion if they can help it before they get into office. And I think that, the system of keeping legislators in line from, this idea that they'll lose committee assignments even, that they'll lose committee leadership positions if they defy their leadership. That is very, very prevalent at the Kansas State House. And there have been examples made of people, and there are lots of instances that we can point to where that happened. So I think that it's a matter of legislators needing to be just as concerned about what their constituents think as they are about what their leadership thinks.
We have a question here about whether the Kansas House or Senate leadership are more opposed to expansion. I would say that both the Senate President Ty Masterson and the House Speaker Dan Hawkins wear their opposition as a badge of honor and are dead set against it. I get the sense there's probably more support in the House. I'm not sure in the Senate if a up or down vote would pass Medicaid expansion. It would be very close right now.
So I think that if we just had an up or down vote this year, we think that we would have the votes in the Senate. There's been some retirements. There are going to be some new senators. I don't have a sense for after the election what that picture will look like. I think that it seems very personal for Speaker Hawkins. When the issue first came about, he was the chair of the Health Committee. He absolutely opposed expansion as the health chair, and then as the majority leader and the speaker. This seems to me to be like really a core value. I don't know if it's the same on the Senate side, but I don't know that that makes a difference really in the outcome.
In the story that I mentioned last year, the person that I led my story with, Marceline Dover, was a student at Wichita State University when she was diagnosed with multiple sclerosis in 2014. And she appeared before Dan Hawkins' committee in 2015 to talk about her experience. She was basically saved by some philanthropic efforts in that community to help her because she did not qualify for Medicaid and could not afford health insurance. And of course, if you know anything about MS, your functions can deteriorate rapidly without medical intervention. And so 3 years later, in 2018, my senior reporter and I, Tim Carpenter, were at the Capitol Journal, and we have a podcast, a weekly podcast. Dan Hawkins was our guest. He had not had any contact with her in the 3 years since she had appeared before his committee, but he brought her up out of the blue during our podcast to kind of make fun of her as the proponent for Medicaid expansion, falsely claiming that she could have gotten insurance through the university, even though that insurance doesn't actually cover the treatment that she needed. Made fun of her for having a cell phone, what he described as an expensive cell phone. She told me it was a $50 phone from Walmart. And so, I mean, that's kind of where Dan Hawkins is coming from with these individuals. I can read you the quote from her. She said, "They can spout off all of their political talking points that demonize the poor, and if they mark it as being left-wing or liberal or handouts and stuff like that, then they're going to have people believing them. They're taking advantage of people who are not willing to do the research themselves, not willing to look into any of the actual facts about it, and taking advantage of people who are either undereducated or don't have access to the facts, and that's kind of low. It doesn't make sense to me that they can live their life and not feel terrible." Dan Hawkins would not talk to me about this, but this is what he tweeted for Halloween last year. "I look forward to the governor's announcement that Medicaid expansion will bring world peace, will prevent slow drivers in the left lane, and will finally reveal whether the chicken or the egg came first. What the governor won't tell you is that Medicaid expansion truly is taxpayer-funded health coverage for able-bodied adults who choose not to work." On that note, there's some clarifying questions here to clarify the difference between the ACA and Medicaid expansion and how that applies to Kansas. Do you want to take a crack at that, Ricardo?
Take a crack at it. So, Affordable Care Act typically is private insurance that has been put together into basically a consolidated place where you can look at insurances. There is income guidelines to be able to qualify for something called advanced premium tax credit, which is just something that the government can help you pay for your insurance. So the lower you are in that federal poverty level, so closer to 100%, the more help you can get, because insurance isn't cheap, as I'm pretty sure most, if not all of you know. And so if you are a family size of one making $15,000, it is hard to make a $300 to $400 premium payment every month, plus any medical expenses that you have to get for going to the doctor. So it makes it so that insurance is cheaper, so and more affordable, and so that's it's private insurance. There's still income requirements. If you make less than 100% of the federal poverty level, you can technically buy an insurance, but it is at full cost. So I will use myself as an example. So I am 30. The income is based off two things, or the price is based off two things: your age and whether or not you use tobacco. So the older you get, the more expensive that insurance gets without any kind of help. And then if you use tobacco, there's a standard amount of money that just gets added on top of the premium that's already determined by your age. So if you make less than 100% of the federal poverty level, you already have to pay the full price. For me, I already looked at prices for 2025. The cheapest plan for me, base level, this is a plan that has over $7,000 deductible, over $9,000 out-of-pocket maximum. Primary care is like $50, $100 for specialist. that plan for me, lowest price I think I saw was $322 per month. That is without help. With help, that is a lot more affordable. And for some people, especially if you are closer to that 100% of the federal poverty level, can cost you nothing or very little. So Medicaid expansion, all that does is there's that gap between what Medicaid currently would cover and the 100% of the federal poverty level. So the people who will fall below the 100% of the federal poverty level, who normally wouldn't be able to get that financial assistance to make that insurance more affordable, they could go through the state instead and get Medicaid there instead of having to pay $300, $400 or above for marketplace insurance without any kind of help.
Can I just throw something in there?
Yeah.
So when this was passed in the Affordable Care Act back in 2010, it was going to be this seamless system. So the very lowest income people would receive Medicaid. Once you got to 100% of the federal poverty level, you would, excuse me, start to receive these tax subsidies on the Affordable Care Marketplace, and it would help people all the way up to those earning 400% of the federal poverty level. The problem came when the Supreme Court said that states cannot be forced to expand eligibility for their Medicaid programs. When that became an opt-in situation, that's where we have the coverage gap, and that's why we have such a strange situation where people are not making enough money to get help. That seems like we're hearing it wrong, and actually, I did it again. Actually, people say that to me all the time. I think that you're confused. What you're saying doesn't make sense, and it doesn't make sense because the system is not being allowed to operate the way that it was created.
Okay, we have about 5 more minutes. Ricardo, as you were talking, I couldn't help but wonder about the conversations you must have with people in the community as you're telling them what these costs are, what the limitations are, the qualifications are. I imagine you encounter a lot of heartbreak over this.
Yes.
What are those conversations like for you?
So we have, I'll use a recent example. I had a family who both parents were working. They both had Medicaid previously because they got Medicaid, I believe, during COVID, and during that time they weren't doing renewals. They both got jobs, and then they were told during the renewal, one of the parents hadn't worked for a couple months because they were not feeling well. After the review, because the parents made more than, I think it was $700 a month, they were deemed not eligible for insurance through Medicaid. And so it was a situation where I had to explain to them because they're like, well, my kids have it, why don't I have it? And then and they're not from the US, they came from outside of the US, so insurance in the United States for people in the US already doesn't make sense. And then if you add the fact that this is not your first country that you lived in, and like I said, our insurance doesn't make sense even for us. It's that, hey, unfortunately, because of that, your income is considered too high for Medicaid, but some families unfortunately don't qualify for Marketplace because they don't meet that minimum 100% federal poverty level threshold. And so it is that struggle of having to explain to people, well, you're simultaneously too rich but too poor at the same time. And it unfortunately happens a lot more often than I like to do. Well, I mean, ideally 0 times I would have to tell people that, but it happens a lot more than that. Other ones are people who are self-employed, so it's hard to estimate their income. And like you had said with your example, incomes fluctuate. So sometimes one year you'll do really good, and you're able to get insurance through the Marketplace because you do meet the minimum income guidelines for it, and then the next year you're like, hey, I haven't had much luck with my self-employment here, and I haven't worked for I haven't gotten a job in the last 3 to 4 months, and that will drop them below 100% of the federal poverty level. So an insurance that they've had and that they've been able to use, unfortunately, gets taken away from them because they can keep it, but then all their income goes to paying for that insurance, and so it is difficult conversations that you have to have, unfortunately, with people who need the insurance and want the insurance, but they aren't able to get insurance anywhere because either their job doesn't offer it or it's too expensive. That's another thing that happens too. Yeah. So there used to be not only, the coverage gap still exists, but there also used to be another gap, which was when you're offered insurance through your job, there's an affordability thing that gets looked at to see if the insurance at work is considered affordable or not. The way it was previously written, it was that if it was considered affordable for the person who works there, then it was considered affordable for everyone in the household. So you have people who work at the school district, which is usually one of the bigger ones that we see this issue with, where they will say, okay, well, for the teacher or for the person working for the school district, the plan cost $50 for them. Super affordable, pretty good insurance, generally speaking. But then to add a child or a spouse, it's $800. But the way the law was written, they would look at the 50, not the 800, and so the other family members who are considered, we would try to get insurance through the marketplace, wouldn't be able to get it because their insurance was considered affordable through work. Luckily, as of last year, that's actually changed, so now they actually look at both. So they'll look at the $50, and so if the employee is considered affordable, they can keep insurance through the marketplace. Or through their work, and then the $800 for the rest of the family, that would be considered an affordable based off, it's a percentage of your income, and then they can get insurance through the marketplace with subsidies so that they can help pay for it, and now everyone gets not hyper expensive insurance, and so that's one thing that's improved, and so that's one conversation I don't have to have anymore, but the coverage gap still happens way too often.
Yeah. We're running out of time, so I'll just say quickly, there's something I think you touched on known as the cliff effect, where either you get an opportunity to work a few more hours or you get a modest raise, and so you end up, we'll say you get $1,000 more in income this year, and that means you lose thousands of dollars in subsidies. And so that's one of the challenges we have here as well. Final thoughts, April?
Yeah. Oh, gosh. Okay, so I just want to make sure that everyone understands it's a reverse cliff when we talk about Medicaid expansion. So everything is kind of turned around there. You can lose, if you don't make enough money, then that's when you actually lose the coverage, where it's the other way around if you're talking about the Affordable Care Act subsidies. Anyway, I would just say, this is so important. If you feel indignant that this is happening, if you feel compassion for individuals who are in the coverage gap, if you are worried about the financial well-being of your hospitals and clinics, please make sure that your elected officials know how you feel. Don't let them say things like, oh, this is going to hurt people with disabilities, or some of the things that we've talked about and debunked here today. Let them know that you are looking for their leadership in finding a solution to getting this done in Kansas. I really appreciate all of the voices across the state who are saying that. And I believe to my core that it's only through working together in a movement that's too big and too loud to ignore that we'll be successful.
Final word, Ricardo.
Voting matters. Making sure that we know who we are voting in office reflects our views is important, And then no matter what they say in the campaign trail, we still have to hold them accountable afterwards. So if they say that they're going to support something and then they don't support it, it's our responsibility as citizens to really say, hey, why aren't you keeping these campaign promises that are the reasons we're voting for you in the first place?
Yeah, if you want to learn more about this, the series that I referenced, we also looked at the impact on county jails across the state, and another story looked at the impact on hospitals, on rural hospitals especially. I forget the number, dozens are on the verge of closing at this moment.
It's like 56.
56 are in danger of closing. And the Alliance has testimonials and other information on their website. So thank you all for joining us.
Wow. Thank you so much to our panelists and moderator for a very, very informative program. One more round of applause for you guys. Just a couple things. There are some surveys on your chairs. If you could please fill those out and give them to either Patty or I. We can collect those for you. Also, the social committee has provided some very yummy snacks out there in the vestibule. So they wanted you to know that please take some home on your way out and partake there too. Our next gathering will be the holiday party on December 4th. Don't forget to register for it on the website. Harry, any final words? So thank you all for sharing your Saturday morning with us. And don't forget to vote and to remind your family, friends, neighbors, and colleagues to do so as well. We'll see you soon.